Hello everybody. Today is World Brain Day, and now, as we all know, I, Dr. Urvi Maheshwari, a consulting physician at Zynova Shalby Hospital, Ghatkopar, Mumbai, on this day would introduce to our neurosurgeon, Dr. Vishwanathan Iyer sir, who will put insight on how important the brain is for a human body. It's not only being active, it's not about being thinking, but there are so many diseases which we are unaware of. Most commonly starting is with headaches. We all would have faced headache, at some point of time in our life. But are all headaches serious or no? How much serious should we be about it? Let's ask Dr. Iyer about it. Sir, what is your experience? Headache is so common symptom these days, but obviously I am not going to go to the doctor just because I have a headache. So when should I visit a doctor and when should I get myself checked or scanned? If the headache is important, can you guide us, sir?
Yeah. If you have a sudden severe headache like you've never had in your life before, then that definitely needs immediate investigation and hospitalization maybe. So remember one thing, a sudden severe headache like never before in life needs investigation. If your headache is light, if you have had such headaches before in the past which disappears on its own in a couple of hours, then you may not need investigations. Any headache which lasts for more than 7 to 10 days, despite medical treatment like painkillers, definitely needs indication.
Right.
And any new onset of headache in a patient who's never had headache before, even if it is a dull aching slow headache, also needs investigation.
Okay, so you would have operated n number of cases having brain tumors. So can you just put little insight on what is brain tumor? What are the signs and symptoms of brain tumor?
So brain tumor is any abnormal growth which happens in the brain. So it is like any other tumor. Tumor of course means like an abnormal swelling. So any abnormal swelling arising in any part of the brain is called a brain tumor.
Right.
The commonest features which the people should be aware of are a headache which does not respond to treatment, any sudden onset of behavioral changes, any changes in weakness or difficulty using any part of the body, like a patient with a sudden speech weakness or one-sided becoming weaker progressively. That is also could be a symptom of brain tumor. Fourth, any patient with a sudden onset of fits or seizure. That is an indication that something is wrong in the brain, and that could also point towards a brain tumor.
Right. So I think rather than people doing all the heroic activities like chappal sungana and kanda sungana, it is better to, if you have a convulsion or a fit or a epilepsy on road, I think we should immediately get to a neurosurgeon and get him evaluated whether he is something from something really genuine or it is just an epilepsy, and how to proceed about it.
Correct. So I think for acute epilepsy, what I should do is that we have lots of faith and belief that putting the keychain in the mouth and making the patient smell the chopper and all. I think these things are not to be done. What the family or the bystander can do is to just move the patient to the lateral or to one side so that whatever saliva or mucus he accumulates in the mouth will go out and not go into the chest. Most of the seizures will settle within a few seconds.
Right.
So just avoid prevention of trauma to the patient by any hard objects around the patient.
Right.
And if you keep the patient on the side, then he will not aspirate or swallow, or his chest secretions will not go into the lungs and harm him.
True.
But that much should be enough for an acute seizure setting.
True. And I think rather than people, gathering around a patient having epilepsy, it is better to give some space and let one or two people only
handle
to help that out.
Yeah.
That is always better. So talking about epilepsy, sir, why do people get fits or seizures?
See, if I may put forward in a very simple language that the people will understand. A fit or a seizure is like a short circuit in the brain. So whenever there is an abnormal electric impulses in the brain, the patient may have a seizure. The seizure could be because of multiple reasons in the body or in the brain. Sometimes a seizure can happen because of any problems in the bloods of the patient, like electrolyte imbalances can also lead to seizure. Second, if an MRI is normal also, a patient can have a seizure. So seizure could be just because of abnormal rhythm or abnormal electrical activity in the brain, or a seizure could indicate an underlying brain pathology like a bleed or a tumor in the brain or an infection in the brain.
Right. So, sir, once the patient has a seizure or an epilepsy, does it mean that the kid will also have, does it run in family? Does it have a genetic history?
Seizure is a very common problem and epilepsy is also a very common problem. And I always want to convey to the world that seizure or epilepsy does not prevent anybody from leading a normal life. With today's world, with so many new medicines available without any absolute side effects, a patient can be a normal, full-time, working member of the society, even if he's got epilepsy. And this concept that epilepsy is genetic or is congenital or is familial is not there. Most of the epilepsies do not run in families, and most of the epilepsies today can be very well controlled with medical care.
True, true. And so, I mean, as you said, that brain tumor also presents with one kind of an epilepsy or seizure. So, what are the treatment options available for brain tumor these days?
See, first of all, diagnosis becomes important. So, to reaching the neurosurgeon on time, and then probably he will get an MRI done, which will show us the exact location and the area where the brain tumor is. After the diagnosis is made, the treatment options vary between just observation sometimes, not only.
Right.
So sometimes the patient may not need any proper treatment. He may just need observation with a couple of follow-up scans if required. Some of the patients may need medical treatment like anticonvulsants to prevent seizures. Some of the patients may need just a biopsy. If the tumor is in an area which is not so easily accessible, the patient may go for a biopsy followed by maybe a radiation or a chemotherapy. In today's world, of course, we try to tackle the tumors by removing them with a microsurgical or endoscopic techniques. So now in today's world, most of the tumors are accessible and they are removed entirely by microscopic or endoscopic neurosurgery.
Right, sir. So all tumors require surgery, sir? Or there are any other options?
Definitely not. Of course, because of modern neurosurgery and facilities available, the treatment options without surgery include gamma knife or radiosurgery.
Right.
And second, some of the tumors are so slowly growing that you may not even need to touch them. You can just do annual MRI, and if the tumor does not grow, you may not need to operate.
Right. So I remember my almost 8-10 cases you have operated for brain tumors, and they are doing really well these days. They are going to work, they are having their routine life set, and then nobody can even point a finger at them and say that you ever got a brain tumor. So I think, getting treatment on time, visiting a perfect doctor is important rather than just wasting time and let the relatives decide what to do, and just not taking Saridon is very famous, sir. So whatever, if somebody has a headache, they just gulp a tablet of a Dolo or a Saridon. So I think we should definitely go to a proper neurosurgeon and get ourselves evaluated. But let's ask sir, so these days so many of people are under so much immense pressure when they are at work, so lots of stress. So in future there are very high chance of people getting Alzheimer's or dementia. So let us ask sir, on today, sir, World Brain Day, would you give us some insight what we can do to protect our brain, to keep it active for a lifetime so that we do not forget ourselves and our relatives?
I think if you allow me to speak on this topic, I'll speak for too long, Urvi. But to prevent our brains from decaying earlier or becoming older earlier, both physical and mental activity becomes important.
Right.
So what I would request everybody to do is that always engage yourself in some physical activity. So physical activity has got a role in brain health also. So any simple activity like walking, running, jogging, gym, swimming, any activity at least done 4 to 5 times a week should be important for brain health. Second, enjoy your work. Don't make your work be a pressure. If you're working hard also, as long as it is enjoyable and you love your work, it won't harm you. And third, develop a hobby which is away from your work and away from your family. So every man and woman, of course, should devote half an hour to 1 hour for himself or herself every day, engaging in some activity or a different hobby which will keep their minds active. When you become older, it is more important to work or exercise your brain. So simple things like, social life is very important. Nowadays I find that people are spending more time on social media rather than actually meeting friends.
True.
So the importance of a friends and a friend circle to have a long-term good mental health is being proven now.
Right.
So you should have a good friend circle. And along with that, you should engage your brain in activities like, reading newspaper, solving Sudoku, solving puzzles, creating, constructing, arts. So all these things are important to let your brain be active till your body is active.
Right. And so one question I guess every viewer would like to know, many of them have the concept that alcohol is good for heart. So is alcohol good for brain?
Absolutely not. Alcohol, even in moderate amounts, is not good for the brain at all.
Okay, so I think we should encourage people to tell them to leave alcohol, to have most of memory games, to do a lot of physical activities, to socialize and to talk to people so that whatever problems are can be solved out. And apart from that, if any of you have any kind of convulsions, chronic headaches, not understanding anything, then we at Zynova Shalby Hospital have Dr. Vishwanathan Iyer, our neurosurgeon, with us, who will be more than happy to sort out all your queries and answer and help you happily help you to get yourself treated. So you can always connect with us. You can take sir's appointment at 6890000. Thank you all so much.
Thank you, Urvi.
Thank you, sir.